Welcome back to 2 Wants to Know. Dr. Patrick Wright, Medical Director of Cone Health's Mobile Health Program, and Dr. Matt Manning, Chief of Oncology, join us today to talk about keeping up with your annual screenings, your checkups, and really your overall wellness. So Cone Health now has a new offering to services the community. It's on wheels. It's the Cone Health Mobile Medicine Program. So we're going to talk about how that works for all different kinds of ailments and things. So Dr. Wright, let's talk about the services of the Mobile Medicine Unit.
Yes, Tanya, the mobile medicine unit provides urgent care services. It's like an urgent care on wheels. So if you had an upper respiratory tract or flu-like illness or even COVID-like illness, we could see you on the mobile unit. We have rapid COVID testing for ill patients in that situation. We can screen you with point of care testing for flu and strep. We can assess fever. We can assess skin rashes, gastrointestinal conditions, chest conditions, back strains and pains, urinary tract, pelvic and vaginal conditions, and as well look at sexual and reproductive health. And as well, we can provide prescriptions for these acute care situations and even provide help and assistance if one cannot afford medications at one of our community pharmacies.
Okay, so that is for urgent care, for when you need it right away. It's on the weekend, it's late after the work hours, that kind of thing. What about if you have a chronic illness that you need to be seen often? Is the medical wheels available that way?
Yes, they are, and it is, and we actually encourage patients to come in even if they've not seen their primary care provider in some time, or they don't have a primary care provider, and we can screen and manage chronic diseases such as high blood pressure, chronic heart failure, diabetes, asthma, chronic lung conditions. We can see patients after they've been in the ER or the hospital for a transition of care visit. We also can establish wellness exams, and we mentioned the Medicare wellness exam earlier, the physical exam. We can perform that as well. We also have a very robust health education program, including a private conference room where the patients can watch health education videos. Prescriptions can be given for these chronic conditions. And we can also provide wellness prevention screenings, and as well we can do things like pap smears on the unit. We have other point of care tests that we can provide as well. And I might mention as well, we have a community case manager, a community case worker who will work with the patient to get you reestablished with your primary care doctor or find you a new primary care doctor. And they will follow up to make sure you've achieved those appointments.
Okay, so we've got urgent care on wheels. We've got the chronic ailments on wheels. Let's talk about cancer center mobile screening as well, Dr. Manning.
Yeah, so we're very happy to have the mobile cancer screening unit. It will allow us to serve underprivileged communities that would likely not have had access to cancer screening previously. In Alamance County, Guilford County, and Rockingham County, we'll be able to provide this service. And statistics tell us that only about 40% of eligible women undergo annual mammography as recommended. So we're very grateful for our 32 host sites, which include clinics, grocery stores, churches, events, and more, that will partner with us to set up these screening events.
All right, and when it comes to these mobile units for whether it's cancer, whether it's urgent care or chronic, is it something where they just go online to be able to figure out if they can get in on this mobile program?
The schedule will be posted on the Cone Health website, and you can go there to schedule a 3D breast mammogram, as well as to get access to colon cancer screening, prostate cancer screening, lung cancer screening, etc.
And the mobile clinic that I spoke of and the accompanying screening van will also have events scheduled at the various churches and shopping centers through our communities we serve on our Cone Health website. And you can see that we're open from 9 to 7 p.m. Monday through Friday, and there's an occasional events on Saturdays as well. And the events rotate to different sites. And we do anticipate spreading out beyond Guilford County in the future to Rockingham, Alamance County, parts of Randolph County. That'll be posted on the Cone Health website.
But this whole thing is about to give people better access so that they don't have to come all the way maybe into town from wherever they are. So you'll want to take a look at that program timeline there so you can see when it's coming to the neighborhood that is closest to you. Thank you, doctors, for joining us today, your time and your expertise. If you missed anything, what you need to do is go to the 2 Wants to Know section and the To Your Wellbeing section. It's going to be posted on there for you as well.